Hi, in this video I'll be talking about insomnia. What is it and what causes it, and really what are the best ways to manage insomnia? Insomnia is difficulty with sleep, just broadly defined. So it includes problems falling asleep, staying asleep, and even that sense that you haven't slept well throughout the night, even when you are sleeping. Breast cancer and its treatment cause insomnia for lots of reasons, including anxiety, fears about what's going to happen in the future, that uncertainty that we have. We can ruminate at night. There are other things that can cause it as well. Lights in the room, even low lights like blue light from your phone or clock or from a computer in the room. The other thing that can cause it are medications. So chemotherapy is not actually the chemotherapy itself, it's actually the medications we give with the chemotherapy to prevent nausea and vomiting, specifically corticosteroids. These can really jazz you up. I've had patients say they're ready to paint their whole living room after getting corticosteroids. So while a lot of people think about chemotherapy causing fatigue, it can also cause problems falling asleep when you're meant to at night. The other thing that can cause insomnia is having a sort of disrupted or messed up sleep cycle. So people tend to take naps when they're getting chemotherapy because they're not doing their normal routine, and that can interfere with your sleep-wake cycle and make it harder to fall asleep. So I'd like to talk next about what you can do. And a lot of this is going to sound like common sense, but it's nice to know, and you can share this with people in your life, that there are things you can do. One is to avoid napping during the day. And if you do nap, just take 20 minutes. This is really hard for me. Once I fall asleep, it's hard for me to get up. So you're not alone, but I do recommend a 20-minute nap. That's generally the amount of time that experts have recommended, and you wake more refreshed. So even if you have to set an alarm, just if you take a nap, keep it short. The other thing to do is to get your worries and anxieties and the things you're thinking about out on the page earlier in the day. So, when the house is really quiet and everybody's asleep, that's not a good time to be processing things. So I've had patients set aside time in the late afternoon, let's say 4 o'clock, tea time, if you will, and you just write for 10 or 15 minutes, all your thoughts. You just don't even lift the pen from the page. That can be really more effective than telling yourself not to worry. We can't really talk ourselves out of worry. Those thoughts will come up. But get them down on the page earlier, not after dinner time, but in the afternoon. A couple other common sense things: don't drink a lot of fluids at bedtime. So if you find you're waking at night to go to the bathroom, stop drinking much earlier and see if that will help you sleep through the night. The other thing is to have a very dark and quiet room. A recent study out of Northwestern showed that sleep is disturbed to the point of raising stress hormones in the body with even low-level light. So you want your room as dark as possible. Now this can be really hard if you live in an area that's very bright at night, or if you don't have room darkening shades. So this might be something your family and friends can help you with, is to put up some blinds or shades to keep the room as dark as possible. There's also tape you can put on your appliances to black out any blue light during the night. Smoking can make it really hard to sleep, and this is going to sound really obvious, but limit your caffeine. Even though we don't feel the alerting effects of caffeine later in the day, even a little bit of caffeine in the morning can disrupt our sleep at night. And while alcohol can make us sleepy and sometimes relaxed, it actually makes us wake up in the middle of the night. So it allows you to fall asleep more quickly, but it disrupts your what we call sleep architecture, that ability to go into deep sleep. I've covered a lot of things here. You might be wondering, are there medications? Certainly you can talk with your medical team if you're having a really hard time sleeping. Oh, the one thing I didn't mention is try to exercise a little bit every day, but not after dinner time. So even if that's your usual workout time, try to work out earlier in the day. These are the kinds of things your medical team will tell you before you go on medications. And that's because they can make it harder to wake up the next day. And some sleep aids can actually have dependence, so you can become dependent on those medications. I've covered a lot here. If you want to learn more about the treatments that you might be offered, visit Yerbba.com. And if this video has been helpful, Click like and subscribe, and that'll help other people going through the same thing find these videos.